Good afternoon and welcome everybody. Thank you for joining us today. My name is Andrew Dauphiney and I'm the Instruction and Outreach Librarian at the New Jersey State Library. And our presenter today is Cathy Forbes from the Mercer County State Health Insurance Assistance Program. Cathy has been the program coordinator for the Mercer County SHIP team since 2016 and is employed by the Children's Home Society of New Jersey. Since emigrating from the UK, Cathy has enjoyed meeting and working with the local population and aims to use her MBA in healthcare leadership to support Medicare beneficiaries, their families, and caregivers as they navigate the complexities of Medicare so that they do not overpay for their coverage. So I'd like to welcome Cathy to today's program. Before we get started, a few housekeeping items to go over. If you have any questions, please submit them using the question box, or you can email me directly. My email is adauphinee@njstate.lib.org. And we'll be taking questions periodically, as sometimes it's easier to answer specific questions when the topic is fresh on our minds. So there is a handout for today. If you would like to download that, you can find that under the handout section of the GoToWebinar dashboard. You can just click on the file and it should download or pop up in another window. If you are using Google Chrome, there is a chance that it will not load correctly, and that could be because of some of the settings that you have associated with Google Chrome. If that happens, you can try opening it in another web browser, or you can just wait for my follow-up email and I'll make sure everybody gets a copy of the handout. There will be a survey at the end of the webinar as well as in a follow-up email. If you could please complete that, we greatly appreciate your feedback and it really does help us inform our programming going further. And if you're looking for more information about the State Health Insurance Assistance Program in Mercer County, which partly administers the Medicare benefits for this area, you can visit the web address on the screen, and I'll make sure to send that out to everybody at the start of the presentation, so you have a link to click on. One last thing before we jump in, for those of you who are not familiar with GoToWebinar, this should be what your dashboard looks like. If you do not see this, look for this orange box with a white arrow either at the top left or right hand side of your screen. That button will open and close the dashboard, so it's possible that the dashboard loaded closed on you. If you have any problems or having trouble navigating or figuring anything out and you want to get in touch with me, please use this raise hand button right here. That'll alert me that there's some type of issue and I will get in contact you and hopefully be able to resolve it. As I said, there's a handout today, which you can find in the handout section here. And then below that is the questions box where you can type in your questions at any time, hit the send button, and then that'll get sent to us. And we'll be happy to answer that for you. So that is everything that I have. So I would like to turn it over to Cathy.
Okay, so hopefully everybody can hear me. My name is Cathy Forbes. As Andrew said, I'm the coordinator for the Mercer County SHIP program. It is actually, not only is it a statewide program, it is in fact a nationwide program, although the state health insurance assistance programs in other states may have different names. The aim is to provide people with local knowledgeable information about Medicare and the parts of Medicare without being prejudiced or selling you anything. So we will never charge you for any of the information that we provide. And I'm always happy to help people from other counties if they would like some assistance, but I can also direct you to your county coordinator so that you can speak to someone who knows what things are like in your area. So just wanted to get started to see if we can get an idea of how many people are already on Medicare. So here we go. So it looks like 2/3 of you are already on Medicare and 1/3 of you aren't. So what I'm going to do is, as I go through this, I will make sure that I explain the different parts of Medicare. If you feel that you're new to Medicare and this is all going over your head a little bit, don't be worried, because we can set up an individual virtual appointment with one of our certified SHIP counsellors to go through everything with you. So when we talk about Medicare, often people will say that Medicare has 4 parts. Now, each part of Medicare has monthly premiums, it has its own deductibles, its own cost-sharing rules for services. Sometimes it's a co-insurance, so it's a percentage of the cost, and other times it will be a fixed copay. And very confusingly, each part has a different rule for enrollment. Now, when you look at when you're looking at Medicare, you will, hopefully everybody can see my screen again. So when you look at your Medicare card, the red, white and blue card that gets mailed out to you, you would only be seeing Part A and Part B on that card. Those are the 2 parts of Medicare which are administered by Social Security. They are the only parts that are on your card. Part C of Medicare is better known as Medicare Advantage plans. When it was originally conceived, it was known as Medicare Choice because it was a different way of organising your Medicare. And Part D of Medicare drug coverage was only made mandatory in 2006. So again, you won't see that on your card. And that means that if you want to enroll in either a Medicare Advantage plan or a drug plan, you don't do that part through Social Security. You have to do it yourself. And that's where our SHIP team very much help you. So I'm just going to go over each of the parts, the costs, and some tips to make sure that you're not overpaying on any of those. So Part A of Medicare, that is your hospital insurance. So it pays for your hospital stays, but it only really pays for your bed, board, the general nursing care, things you can only get in hospital. When you think about your doctors, most doctors have an office outside of hospital, so they will actually be covered under your Part B of Medicare or your medical insurance. Now, although I said Part A is known as hospital insurance, it does also cover rehab centre care, some home health services, hospice care, and blood if you need transfusions. Now, for most people, there is no monthly premium for Part A of Medicare, as long as you have contributed to Medicare through your Medicare withholding tax for at least 10 years or 40 quarters, or you were married to someone who paid in. If you have not got sufficient quarters, there is quite a hefty cost for Part A of Medicare. I tend to find that for people who maybe have worked overseas or have moved to the US, having spent most of their working life overseas. And I'm happy to talk to anybody who's in that situation about what those costs would be. For some people, if you haven't had a work history, you may find that you're eligible for Medicaid, and Medicaid will pay that Part A premium if it's there. But for most people who have lived and worked in the US for the majority of their life, they will have no monthly premium, and as a result, there is no late enrollment penalty for Part A of Medicare. The big cost for Part A of Medicare is the deductible if you are admitted to hospital. So if you are admitted to hospital in 2020 and you only have your red, white and blue Medicare card, you have no other coverage, that deductible would be $1,408. As soon as you are an inpatient in hospital, even if it's just for one night, you end up with that $1,408 deductible. Your bed and board would then be covered for the next 60 days, but after that, there then comes a daily copay. The bit that I want people to draw your attention to when we're thinking about costs is that the inpatient rehab is only covered by Part A if you have a qualifying hospital stay first. That means that you have been an inpatient in the hospital for 3 nights. What can be confusing is that you can be admitted to hospital but not be an inpatient. You may be there under observation. If you're under observation in the hospital, and you will get a notice called a moon notice, that will show that you are as an outpatient, and therefore your rehab stay wouldn't be covered. So it's very important to understand if you or your loved one are actually an inpatient or not an inpatient. And if you then go to rehab, there are co-pays if you stay over 20 days, and Medicare will cover you for up to 100 days. Now, at the moment, the requirement of qualifying hospital stay has actually been waived for most people during the COVID-19 pandemic. But it's something that I do like to point out to people to make sure that you know. The other reason why I point out the high cost of the deductible is that it helps to explain why there are so many other costs for additional insurance that help to protect you against the parts, against the healthcare costs that Medicare otherwise doesn't cover. Now, moving on to Part B, so this is your medical insurance. This is the other part that would show on your red, white, and blue card. That pays basically for the services that you would get outside of hospitals. So doctor services, outpatients, tests, lab tests, MRIs, x-rays, outpatient therapy, outpatient mental health, home health services, durable medical equipment, which would be things like hospital beds or wheelchairs that you use outside of the home, blood as well, and then the ambulance service. Now, ambulance coverage is only covered by Medicare if you cannot safely travel by any other means. So that means that you must either need to lie flat for the duration of the journey, so you had to go in an ambulance, or you require monitoring for the duration of the journey. The coverage of ambulances by Medicare does not relate to whether you are admitted to hospital or not. So even if you got to hospital and you're able to go home, and you can go home in a taxi straight after, if you had to be monitored on the journey in, that ambulance trip would be covered. However, if you could have got to hospital safely, sitting upright in a car, but then you're admitted to hospital and stay there for 10 days, the ambulance trip would not be covered, because at the period when you took the trip, you could have gone by another route. So, and ambulance services, it is something which people do end up getting bills from the ambulance providers for. You can appeal, but it's just to be aware that the rules are quite strictly applied. Now, I skipped over the preventive healthcare services, and that's because that is something I'm going to talk about a little bit more, because it's where one part of Medicare where you do get something, not quite for nothing, but Medicare would like you to stay healthy. So there are preventive healthcare services that are provided for free or low cost, and I have got a full list of them coming up. And here they are. So when you first come to Medicare, you get a welcome to Medicare physical, followed by an annual wellness visit. They do need to be a full calendar year apart, and it doesn't cover blood tests, but it is a free benefit. So if you have original Medicare, so you have parts A and B of Medicare, and you either have no other coverage, or you have coverage that pays after Medicare pays, make sure that you are getting your free preventive benefits. There are different rules for how frequently you can have these various screenings or when they are required. That is provided on the medicare.gov website or in your Medicare and You handbook, which gets mailed out to you every year once you're enrolled in Medicare. So as long as your provider accepts the Medicare approved rate or assignment, then you'll get those benefits for free. And it does include your flu shot. And as we come into flu season, I just want to remind everyone to make sure that you do get your flu shot this year. Unfortunately, Part B of Medicare does have a premium. For most people in 2020, that premium is $144.60 per month. If your income on your last tax return, though, was more than $85,000 if you were single, or $170,000 if you filed a joint tax return, then you will pay a higher premium. But that doesn't have to be the case if your income this year will be lower than your last tax return. So for example, maybe you were working and you were earning really well, but since you left your job, then your income has dropped right down. You can appeal that higher premium, and the form you want is SSA 44. You may need to do that for up to 2 years because of the way that the tax returns, when you file them, you're basically filing from 2 years previously. So you may have to appeal it both times, but it can make you quite a big saving on a monthly basis. On the flip side, if you have an annual income that is less than $17,466 or jointly less than $23,514 if you're married, and your assets are less than $7,000, you may well be eligible, you should be eligible for the SlimB program that pays your Part B premium for you. The SHIP program can help you with that application because we can do that online for you through the NJ Save portal. And we're finding that for people that is getting approved within 1 to 2 weeks, which means that if you are paying that $144.60 and you're eligible for the state to pay for it for you, we can get that back in your bank account so you're not paying it from as early as the following month. So do just check what your incomes are and make sure that you're not overpaying for Part B of Medicare if you don't need to be. Now, Part B does have a deductible, unlike the hospital deductible, which is a benefit deductible, so you may have to pay it more than once per year if you're readmitted to hospital. The Part B deductible is just once a year. It's $198. After that has been met, Medicare will pay 80% of the Medicare approved rate for the covered services. Good news is that the Medicare approved rate is generally a lot lower than what you would see that the doctors or providers would like to charge you for the services. So it's set nationally. So somewhere like New Jersey, where we have quite high healthcare costs, the Medicare approved rate is considerably lower generally than what the doctors would like to charge. And if your provider accepts Medicare assignment, they cannot charge any more than the approved rate. And if they accept Medicare, but not Medicare assignment, they can charge up to 15% over the approved rate. It's confusing, I appreciate. You can ask your doctor, you can say, do you accept a Medicare assignment? And they'll be able to tell you. If you know they accept assignment, you know that that Medicare approved rate is the maximum that will be charged. Generally, the only area that we see this happen, that doctors do not accept assignment, is generally in psychiatry. And that's just because the rates for mental health seem to have been less clearly worked out than the rates for physical health. Now, you may be thinking, and I'm just going to go back and say, if you're thinking that you're paying $144 for something, that's a lot of money every month if you don't need it. So you may want to know, can I delay my Part B enrollment if I have coverage from anywhere else? And the answer is yes. If you become eligible for Medicare, that will either be because you've turned 65, or if you're on collecting Social Security disability benefits, once you've been on Social Security disability for 24 months, you can still defer your Part B enrollment if you are still working and covered by health benefits from a large employer, or your spouse is working and you're covered through their large employer. Now, a large employer is more than 20 employees if you are over 65. And if you're on Medicare due to disability and you're under 65, then a large employer is an employer with 100 or more employees. Now, if you are not covered through working health benefits, for example, if you're on COBRA, if you have retiree coverage, you have no health coverage, or if you're covered by a small employer or marketplace coverage only, then you do need to enroll in Part B once you become eligible for Medicare. It used to be that at 65, most people were automatically enrolled in Part B of Parts A and B of Medicare, and you had to reject Part B. Now, if you are not collecting cash benefits at age 65, and most people are not, then you will need to make sure that you do enroll if you require it. And you can enroll in Parts A and B of Medicare using the your My Social Security account, so you can do it online, or during the COVID-19 pandemic, you can do it over the telephone by calling your local Social Security office. And you can use the Social Security website to find your local Social Security office and their telephone number. So Part C and D of Medicare, as I've said, you will not see them on your Medicare card. They are both optional. So Part C is better known as Medicare Advantage, and in most cases that includes drug coverage. And Part D of Medicare is drug coverage on its own. So generally you cannot have both a Medicare Advantage and a Part D drug plan. Just to make things difficult for me, the New Jersey State Health Benefits Plan is the exception to this rule. So people with a New Jersey State Health Benefits Plan may well have a Medicare Advantage plan and a separate Part D drug plan. But when you're looking at the commercially available plans, you cannot have both. And although I've said that drug coverage is optional, once you become eligible for Medicare, you do have to have creditable drug coverage. So that means you have to have drug coverage that is at least as good as a basic Medicare drug plan. So what is at least as good as a basic Part D drug plan? Well, that would be employer, union, or retiree coverage on the whole. And you can confirm with your insurance company if that coverage is considered creditable. Equally, if you have drug coverage as part of a Medicare Advantage plan, that would be creditable drug coverage. What would not be creditable would be a prescription discount card, so something like the GoodRx card, a drug manufacturer program, or any pharmacy or supermarket programs. So I know that Sam's Club and I think Walmart, they allowed you to enroll in their program and you could get discounted medications. That is not creditable drug coverage. If you don't have creditable drug coverage, you are at risk of a late enrollment penalty. Once you become eligible for Medicare, you cannot go over any period of 2 months or 63 days without creditable drug coverage. Once you go over that 2 months, you are liable to a penalty. That's 1% of the average national Part D premium. And then multiply that by the number of months where you didn't have drug coverage. So if you said, I don't take any medications, I'm not going to enroll in drug coverage, and you waited 3 years before you wanted to enroll, your penalty would be 36% of the national Part D premium. Or in 2020, you'd be paying $11.80 per month on top of any Part D premium, be either a Part D premium or a Medicare Advantage plan premium. So you're paying that unnecessarily and in addition. The penalty continues for as long as you're enrolled in the drug plan. It will be recalculated every year, so it may go up or down depending on what the average Part D premium is. And also, you cannot just pick up Part D drug coverage when you want it. You have to wait until the fall open enrollment period to enroll for coverage starting on the 1st of January the following year. Now, I'll talk through the different parts, so it's understanding how they fit together. So you have 2 options. You can either have original Medicare, so your red, white, and blue card, and you can add to that then drug coverage and a supplement insurance, like a retiree or a Medigap policy that pays after Medicare pays. Or you can have a Medicare Advantage plan, so Part C of Medicare. And you've then got either an HMO or a PPO plan that generally includes your drug coverage, and you show 1 card for everything. You are still enrolled in Medicare, but instead of your bills going to Medicare, they will go to the Medicare Advantage plan provider. And that means that they can set their own co-pays and their own rules. So I'm going to go through these in a little bit more detail. So if we're looking at original Medicare and you're adding drug coverage, what does that look like? Well, the Part D prescription drug plans will be offered by insurance companies contracted by Medicare. Where they're available, they must offer 2 prescription drugs in each treatment class. It does cover insulin and the supplies for injecting insulin, but the test strips actually come under Part B of Medicare. And the drug plans also cover most vaccines. They cover both the cost of the medication and the fee to administer it. So that would be something like shingles. The flu shot, as I said, that is covered under Part B of Medicare, so that is separate. Also, medications that you receive in hospital that are infused, such as chemotherapy medications that are infused, they would be under Part B of Medicare. However, if you take a chemotherapy medication that is a tablet that you take at home, that would come under Part D of Medicare. So that can make a difference as to how much you're paying. If a drug is not on the formulary for the drug plan, you will have to pay the full cost of the medication because your drug plan won't be paying anything towards it. And the formulary drugs will be put into tiers that will make a difference to how much you pay. So tiers 1 and 2 are generally your generic medications, so they will be the lowest cost. Tiers 3 and 4 are brand name medications. Tier 5 is the specialty medication, so they will cost the most. And then tier 6, it's a new tier that's been added for clinically effective low-cost medications, and that will actually be lower. It's slightly confusing. It's much lower than tier 5, the cost of that. It's not offered by all plans, but those that offer tier 6 medications, you can sometimes make a saving on those particular drugs. So how do you decide between all these different plans? It's very hard because the premiums range hugely. In 2020, they went from as little as $13 per month to as much as $116 per month, with an average of about $35. The deductible in 2020, the maximum was $435. It will be going up a little for 2021. I seem to have written the same figure. It should have been, I think it's going up to $445. Now, generally, if you have a plan that has a deductible, it will have a lower premium. The plans with a higher monthly premium may not have any deductible at all, or it may be a lower amount. Now, for some plans, even if they have a deductible, it does not apply to those tier 1 and 2 generic medications. So do check a plan that has a deductible. If you only take tier 1 and 2 medications, you may not be affected by that deductible at all. There are then 3 different coverage periods after the deductible. The initial coverage period, where you pay a percentage of the drug cost defined by the insurance. Once you and the insurance have paid $4,020, you go into what's known as the coverage gap or donut hole. It used to be that you would pay 100% of the cost of the medication during that donut hole. Although you will hear that the donut hole is now closed, it has closed in that you're not paying 100% of the cost of your medications, but you will pay no more than 25% of the cost of your drug medication until you get to $6,350 paid by you and the insurance, at which point you go into what's called catastrophic benefit, where you pay 5% of the cost of the medication, or between $3 and $8 for your drugs. The rest will then be paid by the insurance. For some people, or for a lot of people, will never get out of the initial coverage period. There are some people who go through all the coverage periods and are in catastrophic benefit by February of the year. It depends on the medications that you take. So what we will do for you as SHIP counsellors is we will help work with you to use the Medicare.gov Plan Finder tool, enter in your current medications, their dose and frequency, look for your preferred pharmacies, and then we include mail order options, and then look for the plan for you with the total lowest cost premium medication cost. Now, you can absolutely do this yourself, but the information that's churned out can be quite hard to understand the first time you look at it, which is why we're very happy to walk you through it or do it for you and tell you what the lowest cost plans are and what the difference might be. And one of the things that we remember to do is to look out for any coverage restrictions. So some medications will have quantity limits. For some of them, it won't make much difference. So, for example, generally all of the statin medications, which should only be taken once a day, have a quantity limit of 30 to be issued per month. Some of them, the coverage restrictions may be problematic because it may be a medication that you need in quantities larger than will be covered. Prior authorization would mean that your doctor needs to give prior authorization before you can take that medication. That's usually a fairly simple process. But what you might want to watch out for is if your medication requires step therapy. So the insurance company is requiring that you try other medications before they will cover that more specialist medication for you. And that could be very frustrating if you know you need that medication and you don't want to have to go back and start and show all the other medications don't work. What's really important is that you review your plan choice every year during the annual enrollment period, and this is coming up. It's October 15th through December 7th, and you need to make sure that if you are responsible for enrolling in your drug plan and paying for it, that you review it every year to see what works for you. If you have the state health benefits plan, then that's effectively what the state would be doing for everybody. They're looking for the best plan choice for the following year. It's not individual to you, but they are looking as an organization to make sure that they're getting a good deal. If you are on a state pharmaceutical assistance program and the state is paying for the plan, they will actually do an individual search for you to find the right plan for you. But if you're the one who's having to dip your hand in your pocket to pay for that drug plan, I really cannot emphasize enough to review that plan choice, because there are no prizes for being loyal to your drug insurance company. Last year, there was a plan that doubled the premium for a specific drug plan, and they actually offered a lower premium plan but didn't think to tell people that that was available. So that's what we as SHIP, we're not selling you anything. We just want to help you find the best deal for you. New in 2021, there is something called the senior savings model. Now, this is particularly important for anybody who takes insulin, because it will cap the cost of insulin at $35 per month in any phase of coverage that you're in. So you can see on this slide, it shows that if you were in a standard non-model Part D plan, you would pay up to $435 during the deductible for your insulin. Then you'll be paying $40 to $50 for a monthly prescription in your initial coverage. If you end up in the coverage gap, it's $125, and then catastrophic phase, you're under $35. If you look for a plan that has the senior savings model, then you should in theory save over $400 on average per year on your insulin, because you're going to pay no more than $35 during each of those phases. Now, the plans for 2021 have not been released yet. We won't know what they look like until October 1st. But we will be able to use that plan finder tool, or you would be able to use the plan finder tool to filter out to see just the plans that offer that senior savings model. And the aim is to make the insulin costs more predictable, which, if there is anybody who knows someone who has diabetes or has had to be on insulin themselves, will know that the variation in costs can make it very difficult to budget. Now, I talked about the state pharmaceutical assistance programs briefly, and I just want to go over them again. These are programs that help with your Part D prescription costs. The state programs are for New Jersey residents only. There are 2 state programs. They are paid for through the casino monies. So this is not additional taxation that we're paying anywhere else. So I say to people, for as long as people are going down to Atlantic City and gambling, make sure that if you're eligible, you are getting enrolled in a program. Both these programs do not have an asset limit. They only look at your income. The only way that your assets would be counted is if they are generating income. So if you have $1 million in the bank account, then the interest from the $1 million would be counted as income, but the $1 million itself would not be looked at. So with the first program, it stands for Pharmaceutical Assistance to the Aged and Disabled, but we shorten it to PAAD or PAD to make it easier to say. If you are enrolled in that program, the state of New Jersey will enroll in a Part D plan for which they will pay the premium, and very importantly, they will pay any late enrollment penalty. So if you are eligible for this program, the state of New Jersey can actually enroll you at any point in the year, so you don't have to wait. They will pay the penalty and they'll pay the premium. And then it will cap the costs when you go to the pharmacy counter for no more than $5 for a generic medication and $7 for a brand name medication, as long as they are covered. And that won't change. There's no change regardless of which phase of coverage you're in. So the income limits in 2020, I find it easier to work on it per month. So it's less than $2,367 per month if you're single, and less than $2,900 per month if you're married. If you're married, it doesn't matter whether you file your taxes jointly or separately or not at all. It's purely looked at as joint income if you are married and you live together. If you are separated, usually the state of New Jersey does not recognize separation, but if you are not living in the same place and you're not mingling your finances at all, you can be assessed as a single person if you are separated but not divorced. Now, the Senior Gold Prescription Discount Program is less generous in what it offers, but it does have a less stringent income eligibility. Unfortunately, the state won't pay your Part D prescription plan for you, and they won't pay your late enrollment penalty, but it would allow you to join a Part D plan at any point in the year if you didn't have one already, and it will wrap around your prescription plan. You then pay $15 plus 50% of the remaining costs for medications. I spoke to somebody just last week who told me that they had been charged $64 for a medication, and if we find them eligible, I think they will be eligible for Senior Gold, then they would get a discount on that. It's not everything, but if you're saving yourself $25 on a prescription, you can spend that $25 on yourself, and why not? Or just put it towards bills, whatever you need to do. So the income eligibility for that you can see is $3,200 per month if you're single, or $3,734 per month if you're married. Now, all those figures I've given you for any programs to help with Medicare costs are always the gross income, so it's before any deductions, and that includes before anything is taken out for Medicare. So remember that the Part B of Medicare is $144.60. You have to add that back in. Now, there is a federal program called the Extra Help Program. If you're on Medicaid or receive assistance through your Part B premiums, then you'll be automatically enrolled into the Extra Help Program. If you're not on one of those programs, but you are already enrolled in Extra Help, it's still been maybe worth you applying for the PAD program, because with the Extra Help, you could be paying up to $8 for your brand name medications, and PAD brings it down to $7. So if you're in that situation, let me know. All these programs are applied for through that NJ Save portal. So as I said, we at SHIP can help you with that. You can apply for it yourself through the NJ Save portal on the state website, or we'd be happy to do it for you. The reason why I suggest we can help is just that when you look at it, it's a lot on the application. It can be a little bit overwhelming. We do this not quite day in, day out, but we do it regularly, so we can help make sure that we get everything in there correctly. And we want to get you approved as quickly as possible. So NJ Save, it's one application that will screen you for PAAD, Senior Gold, and that federal Extra Help. You can also use it to enroll in the program that helps with Part B premium costs, the SlimB program. It can also help with utility assistance, so help with heating bills, and it will also screen you for food stamps as well. If you go to www.aging.nj.gov, you can get to the NJ Save portal, or like I say, we can assist you with that application. And the telephone number that I've put there, that is my direct line, so you would get through to me as well. So I've talked about Part D prescription drug coverage. So if you're going for original Medicare, you could have that, and you may then also want to add your may want to add a Medigap policy. So let me explain what that is. So when you're paying for healthcare with original Medicare, so just with your red, white, and blue card, you are paying. Oh, sorry, I couldn't think what I'd written. I do apologise. So, how do you pay for healthcare when you have original Medicare? Well, you could agree to pay out of pocket. So you're paying nothing additional for that, but you will be liable for those deductibles, co-pays, and co-insurance, and there's no maximum out of pocket for the year. So you would be paying that $1,400 deductible if you're admitted to hospital. You would be paying 20% of any of your outpatient costs, and that could be, you could be paying very little, or you could be running into thousands and thousands of dollars over the year. You may have employer, union, or retiree health insurance. Now, if that is the case, your pensions or benefits team can give you more information. Things you want to ask them is, what is the premium? What are my co-pays? Is there a network? And it's just really to understand a little bit more. Are there limitations? Do I need referrals? Now, just thinking about the New Jersey State Health Benefits Program, there was a change that used to pay after Medicare paid. It was a Medigap plan. And then the state decided to go for a Medicare Advantage plan, which then meant that there was a network, and in some situations referrals were required. Now, when that changed, it was quite a big change, and things have been improved since then. But if something like that is changing, the best place to get your information is from your pensions or benefits team. Or if you're not in a position where you have retiree insurance, you can get a private insurance policy. And these would be known as Medigap or Medicare supplement plans. And also, if you are on the state Medicaid program, if your income is very low, it means you're generally below 100% of the federal poverty level, which would be $1,083 per month if you're single, and you've got very little resources, then Medicaid would also pay after Medicare pays. But thinking about those Medigap plans, there are 10 plans labeled A through N that are standardized by Medicare. So all the policies offered through a lettered plan must offer the same coverage. What you will see difference in is in the premium cost. Now, the policies have to be approved by the Department of Banking and Insurance, and any premium increases have to be approved by that department as well. Because the plans pay after Medicare pay, you can go to any doctor, provider, or hospital that accepts Medicare in any of the 50 states of the US and the 4 protectorates. So that would be Puerto Rico, Guam, the Virgin Islands, and Washington, DC. Depending on which lettered plan you go to, you will find that some or all of the deductibles are covered, and you may have some or all of your co-pays and co-insurance covered as well. Now, because they pay after Medicare pays, they only cover the services approved by Medicare. And you can see here the different lettered plans. The most comprehensive plan was traditionally Plan F. That is only available to people who have a Part A start date prior to the 1st of January 2020. So for most people who are new to Medicare, your most comprehensive plan would actually be Plan G, G for golf. And the only difference between G and F is the Part B deductible. You can see that in 2016, the Part B deductible was $166, and in 2020, it was $198. So it has gone up, but it's not going up at the moment in the hundreds, it's going up in the tens, really. Now, Plan N is the other popular plan for a lot of people. I don't know if you can see it on your screen. Plan N, that one, you pay up to $20 when you go to the doctor for an office visit, and you would pay $50 for an ER visit if you are not then admitted to hospital. The reason why Plan N is popular is because you're paying some money towards it, so the monthly premium will be less than Plan G. But obviously, which plan works for you would vary, and the premium costs do also vary. So the cost premiums are generally between $100 to $350 per month. That upper end of $350 is really for people who are maybe in their late 70s, early, or in their 80s and are on Plan F. The $100 a month is more for somebody who's 65 on Plan N. They do vary depending on the letter, age, and the gender of the person who's applying. The premiums do go up with age, but some companies, if there are 2 of you who are applying, they will offer a household discount. Now, if you enroll in a Medigap within the first 6 months of having Part B, you cannot be turned down, and you must be offered the preferred rate for your age and gender. After that period, you will be subject to medical underwriting. So it is down to the insurance company if they will agree to write you a Medigap plan, and they may say that they will not write you a plan, or they may charge you more for the same plan because they feel that your health puts you at risk of making more claims. The only exception to that would be if you lost other coverage, giving you a further guaranteed issue situation. So, for example, if you lost employer coverage or retiree coverage, or if the Advantage plan you were in was terminated or didn't renew for the following year. Once you are enrolled in a Medigap plan, you cannot be removed from it, regardless of your health history. So you could be the sickest person in New Jersey and costing the plan millions and millions of dollars. They cannot get rid of you. So that's why when people are within their first 6 months of having Part B of Medicare, I do say to them, have a good think about whether you want a Medigap, because although you may not require it right now, if you have high healthcare costs in the future, it will protect you from that. Some people would rather pay more and know that they can budget their healthcare costs, knowing what they're paying on a monthly basis. Other people would say it's kind of your attitude to risk. They say, I'll take the risk and I'm going to hope I stay healthy. And if that's more the category that you're in, you may want to look at a Medicare Advantage plan. You will see both Medigap plans and Medicare Advantage plans advertised on the television. So I'm just going to go through that option 2 of your Medicare Advantage. So these are offered by insurance companies contracted by Medicare, and they will either be an HMO or a PPO plan. So that means that they will have networks that are part of them. If it's an HMO plan, then you have to stay within network. If it's a PPO plan, you can go out of network, but you may pay more for out of network coverage. And it's also down to the individual provider whether they will accept your plan as out of network. And you must get all your medical services and drugs through the plan for them to be covered. You can't mix and match and use your original Medicare plan alongside it. So you may be required to go to those specific doctors, hospitals, and labs. You may need pre-approvals or referrals. And the co-pay fees for services do vary between the plans. These are not standardized, and all the claims will be processed by plan. For that reason, you don't need to carry your Medicare card, you just keep your insurance plan card. On the flip side, the benefit is that you may get additional benefits not available through original Medicare. So things such as vision, dental, and hearing coverage or gym membership were traditionally added as additional benefits. These were all pretty basic, but since 2019, plans have been able to offer more benefits. So, for example, expanded dental, home-delivered meals after a hospital, over-the-counter cards to help pay for other items like Band-Aids or bandages, or pads, things like that, or even transportation to medical appointments. But you want to check the summary of benefits for details. Someone spoke to me about the transportation item, and I had to explain it was only 12 one-way trips in a year that would be covered. So actually that would only get you to and from 6 appointments. So it's not as comprehensive as you think. The extra benefits are best described as sweetness to encourage you to enroll in a Medicare Advantage plan. They are not there to provide you with comprehensive coverage. The reason why the Advantage plans can and do offer them to you is because for each beneficiary enrolled in a Medicare Advantage plan, the insurance company will receive $800 or $900 per month from Medicare, which is what they on average budget for what they will be paying for a Medicare beneficiary. So if the Medicare Advantage plans can enroll lots of healthy, well people, then they will be making money. If they have a lot of sick people, obviously they could end up losing some money. So what are the costs of these Medicare Advantage plans to you? Well, because the insurance companies could make money from you, those premiums range from as little as $0 per month up to $196 per month this year. Now, if you were going to pay over $100 for a Medicare Advantage plan, I would strongly suggest that you look at the Medigap plans, because you're paying almost as much as you, or as much or more as you would for a Medigap plan, but potentially you would have more out-of-pocket costs. Now, if you are enrolled in a plan with a premium that's as low as $0 per month, then you will probably find that your co-pays to see the doctor will be at the higher end of the ranges. Not always, but generally that's the way it works. Now, those premiums have to be paid in addition to Part B of Medicare, and you must have Parts A and B of Medicare to be able to enroll in a Medicare Advantage plan. If you have either PA-A-D or extra help, then you will actually get a discount on premiums for Medicare Advantage plans of up to $35.50. And remember that you'll still get your medication costs capped when you go to the pharmacy. But it's not just the cost of the primary and specialist doctors. You need to think about how much is it for an ambulance trip? How much do I pay if I get admitted to hospital? What would outpatient surgery cost? What about an MRI, mental health therapies? On the whole, an ambulance trip is usually a flat rate of around $200 to $250, and the inpatient copays, you're usually paying between $250 and maybe $400 for the first, it depends, but on average about the first 5 days of your stay. And if you think all the way back to when I said that the Part A deductible is $1,400, you can kind of see where those daily copays on Medicare Advantage come from. Now, there is a maximum out-of-pocket costs on medical, which is capped at $6,700 per year. If you were to hit that, after that, the plan would pay the rest of your medical costs, but you would still have drug costs. So how do you find the most cost-effective plan? Remember, your medications have to come through the Advantage plan, so you do need to use that Medicare.gov plan finder tool again to check the cost of your medications. And that would be the same as with the Part D. You enter your medications, preferred pharmacies, and look for the plan with the total lowest premium and medication cost. In addition, SHIP will produce a Medicare Advantage plan summary chart for each county, so you can compare the cost of medical care and also show you what the additional benefits that are offered by the different Medicare Advantage plans available in your county. You do want to check that your doctors are in network with the plan, but be aware they can leave at any point in the year. And also, or you need to be prepared that you would change doctors in order to stay with that, to make that Medicare Advantage plan work for you. Every year you want to review your plan choice. If you're already enrolled in a Medicare Advantage plan, you may start getting mailings around this time of year telling you what will be on offer for the following year. And also you may see that your plan is not being offered next year. If that is the case, as say, you would get an opportunity to buy to be enrolled in a Medigap plan if you wanted to be, or you obviously may want to look for a different Medicare Advantage plan that works best for you. I think I've managed to keep to time. So this is our contact information. As I said, the 609-273-0588, that is my direct line. It's actually a cell phone, which means if you'd rather not speak to me, and you'd just like to operate via text message, you're more than welcome to do that. Being British, I completely understand if people don't want to speak to me and would rather just communicate by text or by email. We're really excited that we do now have a Facebook page here in Mercer County. And we make sure that we post information about SHIP on that. It's very new, but there's some really good info out there, and you can contact us via that as well. And really what we're here to help with is if you need any more information or help applying for the programs to assist with Medicare costs, there's never any judgment with that. If there's a program out there you're eligible for, I strongly encourage you to enroll in it because it's there to help you. If you're not eligible for those programs, we will again always help you with reviewing your coverage choices and costs, and particularly that's relevant during the annual enrollment period, which always runs October 15th to December 7th. So we're coming up. Although you'll get through to me to start with, we have a team of SHIP volunteers who will be very happy to work with you individually. At the moment, everything is virtual. Usually we would meet people face-to-face across Mercer County, and if you're in any of the other counties, again, our teams work in the same way. And if you just have a question about Medicare or a worry, you're welcome to give me a call or a text. If I don't answer, do leave a voicemail. I call everybody back. And I think that concludes everything. So if there's any questions, I'd be happy to answer them.
All righty, thank you so much, Cathy. Yes, if anybody has any questions for today, you can use that or submit them using the question box. Just type it in. We'll get the question and hopefully we'll be able to answer it for you. If it's something more personal and you'd rather discuss it one-on-one, Cathy has all the contact information on the screen, so please feel free to take advantage of that. We'll give it a moment or two for any questions to start popping in. All right, can I make an appointment? I need to sign up for Medicare since I just turned 65.
Yep, so if you have just turned 65 and you need to sign up for Medicare, Parts A and B are through Social Security. So you can do that either online through the Social Security website or by contacting your local Social Security office. If you want to get in touch with me, I can give you the telephone number for your local Social Security office based on your your zip code. And then if you want to have an individual appointment, again, just get in touch with me by phone, text or email, and I can set up a virtual appointment with one of our SHIP counselors to go through your additional coverage choices and options, and they will help you enroll in whether you want a drug plan or a Medicare Advantage plan, and go through the costs of what the Medigap plans are. We can't enroll you in those. You have to do that through a licensed insurance person because they're a big investment. So we need to make sure that you're not being missold them in any way.
All right, thank you so much for that answer. Would you know if New York State has assistance programs like SHIP?
So the New York State SHIP program has a different name. It's HICAP. I will just get the full name for that while I'm speaking. Now, in terms of the federal assistance programs, still exist. So they would have the SLMB SLMB program, and also they would have the Extra Help program. I'm not sure if they have a state pharmaceutical assistance program, but they will have Medicaid. And the HICAP team would certainly be able to help you. Let me just see how they spell it. And why they all have different names, I don't know. I like to think we have SHIP here in New Jersey because we have the long We have the long coastline. Up in Massachusetts and down in Florida, they actually call it Shine. And I say to people, my favorite is the Ohio one, which is OSHIP, because that's the way I think most people feel when they hear they're going on to Medicare. So it's HIICAP is the name of the program in New York, and I can give you their statewide hotline, which is 1-800-701-0501.
Somebody else just wanted to say thank you for the program. It was very informative.
Oh, thank you very much. It's a shame I can't see people in person, but it's nice to still be able to present.
Alrighty, well, if we don't have any more questions, I'd just like to thank everybody for attending today. I'd like to thank Cathy for volunteering to do this. It's always important to get this information out, as it can be confusing, it can be complex, as there are a lot of options available. So everybody, please look out for an email from me that'll have a recap, the handout, as well as a link to the recording of this. So if there's anything that you missed and you want to refresh yourself, you'd be happy to view that. So again, I'd like to thank everybody for coming. I'd like to thank Cathy, and everybody be safe, be well, and hopefully we'll see you again soon.